Hi everybody, good to see you again, so to speak. So this week we're entering our fourth module, week 4. At the end of this week we'll actually be at our halfway mark. Things move real fast during the summer. Everybody's doing a good job keeping up and doing everything that they need to do for the most part. This next coming section that's kind of going on this week is starting to get to some of the meat of our course. So we have neuro, the nervous system, and visual senses this week. So you might find that it feels, there's a little bit more material. It's a pretty long chapter. So just kind of look for the next couple of weeks to feel like maybe we're dealing with a little bit more information because we're dealing with neuro and special senses. We're also going to hit cardiology, the immune system, blood. And so there are some feels like those chapters are a little bit deeper, a little bit more procedures, a little bit more disease processes. So just kind of look for that. It is nice. We get a little break, no discussion this week. So it's a little bit less work. You can focus a little bit more on the homework and studying and prepping for the test. Make sure when you're looking at the homework, a couple people last week, there were actually 2 sheets for one of the homeworks, and some people were only filling out one and sending both in. So just make sure you scroll down. Some homework is just 20 questions on one sheet. Others are 2 sheets with 20 questions. We had a few that are 3. I think we hit most of those early on. So just make sure you scroll down and that you fill out all of them. I think neuro is 1 sheet with 20 questions, and then I think special senses is 2 sheets with 20 questions each. So there's a second sheet. So just make sure you're scrolling down and taking a look at that. I've enjoyed reading. I'm just getting to finish most of the grading for 6 and 7. You guys did a pretty good job with our discussion question. There was a lot of great information brought up regarding skin cancer and malignant melanoma. So everybody did a good job. So just little reminders with the discussion. We don't have it this week, but just make sure that discussion section, that initial post, is done by Wednesday. Remember, nothing this week. We'll hit it next week. But make sure that first post is done by Wednesday. A few people wrote kind of short initial posts, and I am really looking for a good solid paragraph to kind of support and summarize what your research is. So 4 and 5 sentences might not be enough. I do need to see a little bit more with that. And then we had a lot of positive responses with the post, with the classmates post. You guys did a good job with that. So just make sure that those are also 4 to 5 sentences. Those don't have to be as long as the initial post, but we want more than a I like it and a thumbs up. We want to get a little bit of analysis back and a little feedback. And some people were great. They went back in and then remarked on the on what posts were commented on their posts. So that's a nice way to converse and go back and forth. Okay, so you can always, after Friday or Saturday's done, you can always go back in and see if anybody remarked on your post, and you can answer back. That's a nice way to communicate. Okay, so no discussion board this week, just the 2 assignments. Just make sure you look. The special senses has 2 sheets. Those will both be due on Saturday, and then the test once again is due Sunday. Sunday will mark our halfway point. So as we hit module 5, we will be entering into the second half of the course. Okay. So you guys are doing great. I've graded some of the stuff. I'll be grading the discussion sections as we come up. So just remember those little things that we discussed, and good luck to you this week. And I will see you guys next week, and I look forward to reading all the discussions on the sports injuries, football sports injuries. Okay? Take care. Have a great week.